Allergic rhinitis, treatment and prevention. It is a non-contagious, non-infectious ailment produced by the various allergens, which is classified into seasonal and the perennial one. The main allergens are pollens of the flowers, trees, grass, weeds, and the animal dander, dust mite, cigarette smoke, perfumes, and the other inhaling gases and the chemicals, which produces irritation in the mucosa or the mucous lining of the nose and nasal cavity, which spread onwards towards the nasolacrimal duct, sinuses, and the ear of the human body. So there is complication of these organs located in the vicinity. There is injection of the eyes, conjunctivitis, redness of the eye, watery eye and itching eye. There is black circle behind the eyes, sinusitis, head pain, frontal head pain. Then there is pain in the ear due to stuffiness and blockage of the eustachian tube, because there is overproduction of mucus in the nose and the nasal cavity, which spread and block these passages, which are communicated with each other, that eyes, that nose and the throat and the ear. These communicating pathways, they are also inflamed and they are plugged with the excess amount of the mucus and blocks the natural, the function of these passages. So there is obstruction in respiration, there is hoarseness, sore throat, but there is no fever. And it is not a spreading. There is no droplet infection in this disease or the ailment. Though the mode of spread is by the airborne, because the allergens from the environment that enter in the human body through nose and the throat. There is another category, that is food allergy, and that is due to ingestions of particular food which are producing allergy or the hypersensitivity in some persons. So they are the particular foods which are producing allergy in some persons. So there is also genetic predisposition in this allergic rhinitis, and also the persons, the risk factors, the person suffering from asthma, contact dermatitis, eczema and lupus, they are more prone to get this ailment. They are the more sufferer as compared to the normal persons. So the treatment is, because this ailment produces disturbance in the normal activity of the routine duty of the person feels tiredness, fatigue, muscle pains. So to avoid this pain system, we also use NSAID drugs. Then there are antihistaminic, because this ailment is produced basically by the mast cell production of the histamine. Histamine produces vasodilation in the capillaries of the mucous lining of the nose, and that leads to the overproduction of the mucus secretion. And that overproduction, that produces all these complications. So antihistamine block the production of the histamine. But these medicines should not be used during the daytime. Either the patient should get rest at daytime and can use these antihistaminic. Otherwise, the person should use at bedtime. And he should not drive if he is taking the antihistaminic drug due to severity of the symptoms during daytime. He should take rest. Next is the decongestant. These also produce the reduction in the production of mucus secretion, but these medicines should be used only for 1 week, not more than it, because these produce addiction. Next is the anti-inflammatory, that is the blockage of the overactivity of the immune system, immune cells, and they are the steroids, that is prednisolone medicine or decadron, in the form of tablet, in the form of injection, in the form of drops, nasal drops and the eye drops. They are used to provide relief to the patient. So antihistaminic, anti-inflammatory, the steroids in combination can be used in the form of pills, in the form of shots, in the form of spray or the drops in the nose and the eyes to avoid the over secretion of the mucus, to settle the watery eyes and the stuffiness and congestion of the nose. So these are the basic line of treatment. Next is the desensitization. This is a process by which, when we, after performing skin prick test, we detect that such and such allergen is producing this allergic rhinitis in this patient. So we inject under the skin minimum possible quantity of that allergen solution, starting from minimum quantity and then gradually increasing to the maximum one, so that the immune system should not take it ill, should not show any reaction against these allergens, or should not think that this particular allergen is dangerous or injurious or is not beneficial for the persons. So this is the gradual. This can also be employed, or this can also be adopted in person suffering from food allergies like fish, eggs, etc., from minimum quantity of the diet, increasing steadily to the normal required amount. So this is called a desensitization process. We want to train the immune system that these factors, these allergens, they are not injurious for the body and they are not enemy of the body, and the immune system should not be overactive against these allergens. Next is the prevention. You should avoid the entry of the allergens. For that you should use mask. You should not visit during spring season. This is seasonal or the spring rhinitis, allergic rhinitis. You should not visit the gardens when the flowers are in bloom. You should close your windows which are from the side of the gardens, so that the pollen should not get entry in your rooms or in your residential area. You should, if you can afford, you should live in air-conditioned rooms. Next, frequently wash your nose. Blow out the mucus secretion of your nose frequently, and rinse and wash the nose and nasal cavity by the saline water. Saline water, frequent washing, that also kick away the allergens and also produces the reduction in the entry of the allergen through the nasal passage. You can also use saline gargles to make your throat free of the allergens. So these are the basic factors. When you are a field worker, you should also use sunglasses to direct entry of the allergens, attack of the allergens to your eyes, if you are allergic to the various allergens. So frequent washing, hand washing, when you are touching or when you are playing or when you are dealing with your pets, then you should frequently wash soap water, wash your hands, frequently rinsing of the cleansing of your nose and nasal cavity by the saline water, and use of mask, use of sunglasses. So these are the basic preventive or prophylactic measures to avoid this disturbing, irritating, and troublesome ailment of this allergic rhinitis.